How then can my records, the most intimate details of my life, that live on somebody's computer, that can be with a touch of a button sent anywhere somebody chooses to send it, be protected? What's the mechanism for that?
Well, there's plenty of technology that's used in the financial services industry, that's used in the airline industry, out there to protect it. There's various firewalls, there's various ways of keeping that information protected. I think sometimes in this area specifically, we have so many different players. The physicians are a player, the hospitals are a player, the pharmacists, and I think the locus of responsibility and the locus of who pays for it isn't as clear.
Dr. Clemens?
And if I could just pick up on one word, there are a lot of good technological solutions, but it's ultimately got to be about trust. Individuals have to be able to trust that the information about them won't be disclosed without their permission.
They're going to build that trust, though, it seems, based on their experience and the experience of others.
Well,
so if they hear stories like this, they're going to have a hard time trusting. So they're right.
Well, that's correct, and that's why over the past year we've been actually supporting a contract that has gone out and talked to folks in over 17 states and brought them together to try to make sure that we can build this trust into it. Because a big part of the power of this information sharing isn't just wiring Dr. Bence's or Dr. Benjamin's office. It's actually being able to make sure that as you move from one part of the healthcare system to another, your information follows you. So you saw Dr. Benjamin saying, "It's so great that I know all the medications." You have no idea how many times a patient who sees multiple physicians, this is not knowable.
Well, or how about this? You know, somebody's out skydiving in Montana or something, and something goes wrong with the parachute, and they find themselves in an emergency room somewhere, unable to communicate what their condition is.
That's exactly.
Is the idea, you know, they're from Connecticut or something, that the physician can pull up and see the full breadth of their medical condition?
Ultimately, that is what we're trying to build. We're not there yet, but I think we will get there.
How far are we from that?
Well, the President set a goal for the nation that the majority of Americans would have an electronic health record by 2014, and I would say we're making very good progress.
The technology-wise, we could be there much sooner than that. I think it's the trust in the systems.
And without that trust, we should stop talking about this.